Good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikelu. First, the highlights. Cross River State set to administer second dose of COVID-19 vaccines with plans to employ drones for transportation of medicines. A member of Presidential Steering Committee gives more insight into Phase 4 restrictions nationwide. And faced with soaring cases and dwindling drug supplies, Indians residents turn to the black market for medicines. Well, it's the first day of Phase 4 of Nigeria's COVID-19 restrictions, a reminder that we had not entirely come out of the lockdown that was put in place last year. Well, yesterday's announcement was like a bolt out of the blue for some who didn't quite get the rationale behind the reintroduction of some restrictions, most of which were already in existence anyway. We'll bring you an insight into why that decision was made in a moment. But first, let's take a look at Nigeria's daily figures. Well, it sure looks like we're coasting to safety beyond COVID-19's arm's reach. But are we? Could this be a false sense of safety? Don't forget, we've been here before. So maybe when you see the figures coming up now, look beyond them into the future and see what might happen if we don't take appropriate precautions.
As Muslim faithful prepare for the Eid celebrations, it is essential to adapt safe practices for people to protect themselves. In view of this, the Nigeria Center for Disease Control, NCDC, via its official Twitter handle, is advising all people to ensure that they adhere to non-pharmaceutical interventions and avoid the sharing of personal items. According to the National Primary Healthcare Development Agency, over 1.6 million people have now received the first dose of the Oxford AstraZeneca COVID-19 vaccine, representing 84% of the eligible persons targeted. Meanwhile, Kwara State has vaccinated more than half of its target population, as it now has reached 102% of its eligible population, followed closely by Enugu and Lagos states. In the latest update by the NCDC, 49 new cases of the COVID-19 virus reported from 3 states and the FCT have been confirmed in the last 24 hours. The FCT had the highest figure with 27 infections, followed by Lagos, Enugu and Oyo. The overall count of confirmed cases in Nigeria now stands at 165,468. 21 people have been discharged in the last 24 hours, bringing the total number of discharged persons after treatment to 156,318. At a recent briefing by the World Health Organization, the Director General said COVID-19 cases and deaths have recently declined in most regions. However, he cites access to vaccines as one of the biggest risks to ending the pandemic.
Any decline is welcome, but we had been here before. Over the past year, many countries have experienced a declining trend in cases and deaths, have relaxed public health and social measures too quickly, and individuals have let down their guard, only for those hard-won gains to be lost.
Globally, over 159 million cases and more than 3.3 million deaths have been reported across several countries.
The Cross River State government is one step closer to deploying drones in the delivery of vaccines and other essential drugs to hard-to-reach areas. The state governor, Professor Ben Ayade, while signing an MOU with Zipline, is confident that this will be a game-changer in the fight against COVID-19, especially now that the state-owned pharmaceutical company is expected to kickstart operations in the coming months. The drone delivery system, when in operation, will ensure medical supplies can be delivered to health facilities in real time to enable people get help when they need it the most.
We had a meeting some 2 months ago and we gave 11th as a deadline for the MOU signing. And I'm happy that I have a very, very active team that is consistent to the date, and today we are here signing in line with what we agreed in Abuja some 2 months ago. Therefore, I have no fears in my mind that in 90 days we will all be gathered to actually watch and see it take off. Cross River State Pharmaceutical Factory starts running. It will be the major producers of most of these drugs. and we believe that we will be able to building one around that area also very quick. Since your delivery time is about 30 minutes, we have to have them across the 3 senatorial districts to guarantee that from the point of dispensal of the drug to the point of delivery, it shouldn't exceed 30 minutes indeed.
Well, as the state prepares to administer the second dose of COVID-19 vaccine, the government is also asking residents to come out, get inoculated and worry less about the side effects, as the state has not recorded any severe side effects from the first set of jabs which were given. The State Director General of the Primary Healthcare Development Agency, Dr. Janet Ekpeyong, explained that the state has received vaccine for the second phase of vaccination, but they await federal government's permission to commence.
Cross River is ready for the second phase of vaccination. They are calling on all eligible residents to avail themselves of this opportunity by getting involved in the exercise.
As a result of our ability to actually hit the 100% target based on the number of vaccines we were given, Cross River State was actually one of the states that the National Primary Healthcare Agency decided to send more vaccines to because of the high demand for vaccines in the state, and about 25,000 more doses were actually sent to the state recently, and that's why we've currently trying to see how we can utilize or ensure that people can actually be vaccinated to ensure that we hit our targets so far.
Frontline workers across the state who were vaccinated explained that they had no side effects from the first dose of vaccines, as they encourage others to take the vaccination seriously.
I've had my first jab of the AstraZeneca COVID-19 vaccine, and I took it for, it's about a month now, and I'm still here, I'm alive, I'm strong, doing well. Well, the side effect or the adverse effect I suffered weren't unexpected. Just the normal chills, the fever, which is synonymous with vaccine or inoculation.
Initially in COVID-19, some people deceive us that when you took the injection, you will die. But they came to our office here. I personally took the injection. They gave me the injection. Up to this time, I didn't see any infection. Most of those malaria that used to torment me since I took the injection, all those things go away. Right now, I'm still expecting for the second phase for me to take.
So far, we've not had any severe adverse events following immunization. I mean, most of the adverse events we've had so far are the common ones we usually have, after immunization, such as probably pain at the site of vaccination, maybe a little fever, and that's just been it. We've not had any severe adverse events following immunization so far, like what is being reported in some other countries. And I think for us in Nigeria so far, we've not really experienced that, but at least for us in Cross River State, there's been no such reports yet.
The government is sensitizing citizens across the state as they attribute the recent reduction in the numbers of infected persons to the administration of the vaccines, which according to authorities has proven to be safe.
It was about this time yesterday we broke the news that the Presidential Steering Committee on COVID-19 had just announced the transition to phase 4 of the COVID-19 restrictions. Well, it threw a lot of Nigerians off balance, with many asking, why now? How come? In fact, some others wondered if we were back in a lockdown. So what does this phase 4 COVID-19 restriction entail really? Well, what you see is that mass gatherings in a public space has been restricted to 50 persons. Bars and nightclubs should remain closed. And there's, of course, the 12 a.m. to 4 a.m. nationwide curfew is back, as well as domestic and international travel discouraged during holidays, as well as no limitation to intra and interstate travel. Access to government institutions denied to anyone without face mask. And government meetings and travels have been limited to virtual platform as much as possible, as well as some other restrictions. But let's get some answers to those questions you might have asked as well. And Dr. Mukhtar Mohammed is the head technical secretariat of the Presidential Steering Committee on COVID-19. He joins us virtually this evening. It's great to have you on the program, Doctor. Let me begin with perhaps one of the questions that a lot of Nigerians have asked time and again is what prompted the latest restrictions?
Thank you very much, and really thank you for having me on this program. Good evening, viewers. So what has happened is that we have reviewed what is going on internationally in other countries. If you recall, about a week or two ago, we sent out a travel advisory regarding some 3 countries where they have very high incidence of the cases and where also mortality has been very high. And also because of the prevalence of the new mutants of the virus in these countries. These countries are India, Turkey, and Brazil. So we have monitored what is going on globally, and we know that there is really the risk that this infection cannot be transported into Africa and specifically to Nigeria. And we also reviewed our own current situation in the country regarding compliance to the public health intervention measures that are put in place. We have discovered that we have lowered our guards for quite some time now. People are not complying to these regulations, and really enforcement is at its lowest ebb. And therefore, in addition to the travel advisory, we therefore tightened up these measures to ensure that we protect the people in our country, to ensure that our society is prevented and we minimize the risk of importation or transmission of these viruses in the country.
So in spite of some of those things you mentioned, like low compliance and the rest, for some, seeing the numbers that we've been recording over the past couple of days, I mean, they are declining drastically, and they expected that there should be more easing rather than restrictions.
Absolutely. If we rely on the numbers alone that we have, what we are seeing is that the numbers have stabilized. The numbers are few. But if you just dig a little deeper, you realize that the testing numbers are also low, and that our surveillance system is not picking up the viruses or the infections in the community because people are not reporting, because testing is not done as maximum as it should be. Up till this time, since last year, or 1 year now, we have only tested less than 1% of our population. Our test is still below 2 million. And this includes people who have repeatedly taken on this test in a while. Therefore, the testing is really not optimal. So the numbers, they're giving us an indication of what is going on, but in terms of the magnitude, it is not telling us enough because we do not have enough numbers to make that inference. However, the fear of having this third wave is a reality. India was in the same situation that we were just 2 months ago. They're almost at the stage of declaring that COVID-19 is over in the country. People have gone back to their normal businesses where they were not worried much about using face masks or other prevention measures. And there were large gatherings in terms of religious gatherings and also political rallies that were going on in India. These were the fuels, that brought the epidemic to the level they are in India. The same thing with Brazil as well. So we fear that we are in the same situation, and we have to take proactive measures to make sure that we protect our country and our people.
Okay, Dr. Mukhtar, regarding international travel, now I'm talking about traveling outside of the country, the advice that was given, is that a restriction or just saying that, well, you can travel, but be careful?
Well, there are 2 aspects to the travel. For passengers that are traveling from Nigeria to other countries, we advise that people should only take travels that are necessary, travels that are important that you cannot do without them. So that is our recommendation. The second part is for travels for people who are outside Nigeria. This is where we have to see. We look at the high profile of the high-risk countries, and we say that people who are not Nigerians coming from these countries will not be allowed entry into Nigeria. We can only allow Nigerians and foreigners who have resident permit. If Nigerians come in from these countries, they have to undergo mandatory 7-day quarantine.
Well, Dr. Mukhtar Mohammed, there will certainly be a need for further, discussions concerning this, because there are a lot of gray areas which Nigerians would like to get answers to. But we'd like to thank you for at least sparing time to shed some light on this for now. Dr. Mukhtar Mohammed is the head technical secretariat of the Presidential Steering Committee on COVID-19. Well, there's increasing evidence that regular exercise has an overall anti-inflammatory influence, or simply put, it has its positives in helping the body fight diseases. So maybe this might just help at this time when the world is grappling with COVID-19, but then there are restrictions to everyday activities with gyms closed in Nigeria especially. So how can you boost your chances against COVID-19 with physical exercise? Well, let's speak with Oluwadamilare Okinla, who is a fitness expert. He joins us in the studio this evening. Great to have you, Oluwadamilare.
Thank you for having me.
We'll talk about the benefits of exercise, but there's this one I'd like you to clear off. Because we engage in a lot of activities daily, and there's a tendency to think, I'm climbing the stairs, I'm jumping buses, I'm running back and forth, so I'm fit. But how do you know if you're fit or not exactly?
How quickly can you run out of breath when you're doing those normal activities?
Oh, very quickly.
Then you're not fit. Because basically, if it's something that you're used to, that your body is used to, you can tell within yourself that you're not struggling. It's just like, imagine you trying to climb the stairs. Just after a couple of stairs, you start running out of breath. Then that tells you that something is wrong. And also, funny enough, that could even affect your love life as well. How quick, because how can you sustain? And also, when it comes to physical activities as well, when you got to do with lifting stuffs, how much do you feel pain? Or can you suspend? It all depends on how you feel inside you.
Interesting.
You can tell that you're not fit.
Clearly, physical exercise has its application, wide applications, but we're in a pandemic era, and as it stands right now, physical activities generally, we just talked about phase 4 restrictions in Nigeria. Gyms are closed. A lot of places that people would naturally go to exercise out of their homes are closed right now. So the question will be, getting some of this equipment at home might be expensive. So what are the quick wins, really? How can I ensure I'm exercising even though gyms are closed? I probably work from home, sit in front of my computer almost through the day. How can I still exercise daily?
First of all, can you dance?
It depends.
Dancing is a form of exercise that can actually help your heart rate. And also, there's a lot of facilities that's available for people to use. Have you heard of resistance band as well? Have you heard of resistance band?
A resistance band. Right.
Yeah, these are bands that can actually be used in place of a gym. And also running. If you can be running around the house, doing axle calls. At the end of the day, anything that you do that makes you feel that your body is moving is exercise.
But wait, there's exercise and there's stressing yourself, and there's always that challenge between balancing it. There's a point where you're exercising, and there's another point that I'm going overboard. So just before we get to some other areas of exercise, how do you know when you're doing too much?
Okay, basically, you know your body, and you know when you feel that you cannot hold on. That's when you need to take a break. Imagine you trying to do a running, and after a while, you can feel that your heartbeat is actually beating abnormally or faster than normal. That tells you that you need to take a break.
I'm quite interested in this dance one because, Nigerians, we love to dance.
Yeah.
We love good music, right? So what kind of music? What kind of dance routines? Because I see a lot of dance steps around today. Are they all exercise moves or just specific ones are exercise moves?
I'll tell you what, there are some dances that requires you to get involved. Basically moving your body, your legs, your arms and all that. It doesn't have to be a particular routine. You're just moving around. And the good thing is that Afrobeat have a lot of high tempo beat that even you sitting there and listen to them and moving, it helps you. So I wouldn't say specifically, but all you need to do is that sometimes you need faster music with high pace. That alone can actually help you to move anything that you can move in and move to the rhythm. It can actually sort out a bit of, and of course you're burning calories.
I'm sure you've heard people say, why do I need to exercise? It's as though I'm using up my body before time. I mean, there'll be wear and tear. Is there any research that has been done in that area that shows that maybe, just maybe, exercise might be wearing out people's bodies, especially for people that believe that?
Yeah. I'll tell you what, another way you can describe exercise is basically being active. And according to research, people that are more active have a better life, well-being, than people that are not active. So if someone says that if they exercise, they're wearing out their body, no. The fact that you're sitting in one position and doing nothing, you're actually putting a strain on that body, because it's just like an engine. It needs to be oiled. And that's what the body is all about. Imagine you just sitting down, doing nothing, not moving. It makes the body stiff, and at the end of the day, you're prone to be attacked by viruses. We're talking about coronavirus right now. One of the best way to keep it out, to keep coronavirus out of your body, is to make sure that you're active. Because people that have underlying medical conditions that are not exercising, they are more likely to be highly impacted by coronavirus.
One thing is sure, I'm picking up my bicycle later today just so I can exercise. But I'd like to thank you so much, Lord Damilare Okinla, for sharing your thoughts with us on physical exercise, which is quite key. Thank you so much.
Thank you.
Well, over to the foreign scene, where we continue to monitor the situation in India, where more bodies are said to have been washed up on the banks of the Ganges River, north of India. More than 50 bodies have been discovered in Gamar, Uttar Pradesh, over the past few days. At least 40 were pulled from the river, some 55 kilometers downstream from Gamar. Well, no one knows how the bodies got there in the first place, but it is thought that they might be victims of COVID-19. Their identities are also unknown. Well, here's more on the Global Update.
Faced with soaring cases, India's capital city is under a worrying pressure of drug supply, as pharmacies are not allowed to procure much-needed medicines and hospitals are reporting shortages. As panic sweeps across the city, residents are running to get their hands on two main drugs that have been effective against COVID-19, namely remdesivir and tocilizumab. In desperation, some Indian families have had to delve deep into their savings, as medicines on the black market cost as much as 5 times the official price. In Europe, intensive care medical staff exhausted by the battle against COVID-19 have gone on strike in some French hospitals. They are demanding better pay and working conditions. The hard-left CGT trade union says the coronavirus crisis has underlined the need to increase the number of nurses and intensive care beds in public hospitals, as well as improve salary terms. Meanwhile, protesters gathered outside AstraZeneca's campus in Macclesfield, northwest England on Tuesday, calling on the company to share its coronavirus vaccine technology. Activist group Global Justice Now organized a small rally to coincide with the company's annual general meeting. The protesters want the British-Swedish firm and others that have developed vaccines to openly license their shots and share their technology with the World Health Organization.
Ho ho! Vaccine pains have got to go! Hey hey! Ho ho! Vaccine pains have got to go! Excellent!
AstraZeneca has pledged not to profit from sales of the vaccine during the COVID-19 pandemic. Still in Europe, the Danish Science Center Experimentarium has opened the country's first interactive COVID-19 exhibition. The director of the Danish Health Authority, Søren Brostrøm, opened the exhibition with a sneeze in the sneeze simulator. In the exhibition, children and adults can experiment, play, and gain knowledge about COVID-19 and learn about how best to fight the virus both inside and outside our bodies.
This is Channels Television's breaking news.
The breaking news just in, southern governors in Nigeria have banned open grazing of cattle across states in the region, and they're asking the president to address Nigerians on the state of the nation. The governors are also calling for the restructuring of the country to address increasing agitations in different parts of the nation, while restating their commitment to the unity of the country. The governor stated this at the end of their meeting in Asaba, the Delta State capital, a moment ago. Again, breaking news just in, southern governors in the country have banned open grazing of cattle across the state in the region, and they are asking President Muhammadu Buhari to address Nigerians on the state of the nation. Well, don't forget to protect yourself. The virus is still very much out there, so continue to take responsibility and visit our website, channelstv.com, for more updates and better understanding of the pandemic. We also have all the big stories from this breaking news to politics, business, sports, and so much more, all at your fingertips. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikiolu.